My name is Johnny Kiefer, and my presentation is Gender Issues in a Disaster. According to the Merriam-Webster Dictionary, gender is defined as the behavioral, cultural, or psychological traits typically associated with being male or female. Gender roles are learned ideas about how males and females should think, speak, dress, and interact, and are both personally and culturally defined. Gender roles define how men and women function in society. Inequality plays an important role in each step of the emergency management process and can affect one's vulnerability to disaster. Women, men, and transgendered individuals all experience disasters in different ways. According to the United Nations Development Program, women, girls, boys, and men belonging to different age and socioeconomic strata have distinct vulnerabilities, and this shapes the way they experience disaster and also their ability to recover from it. Women and girls tend to be the main victims of disaster. This is due in part to cultural constraints, which sometimes hinder self-rescue for women. In some cultures, women can't leave the home without male permission, and generally women are most likely to be assigned to saving children, the elderly, and the disabled, which endangers theirs and others' safety. Sometimes a lower value of life is placed on females, and they are sometimes sacrificed. Lack of skills like swimming and climbing are only taught to men in certain cultures. Less physical strength, both biologically and because women's access to food is restricted in certain cultures. Women are more likely to suffer abuse after disasters. Rape, human trafficking, and domestic abuse are known to increase drastically during and after disaster. Differing health needs affect women. Disasters can cause women to go into labor prematurely. They can cause simultaneous abortion, and restrictions in sanitary conditions and privacy may affect the ability to care for oneself during menstruation, sometimes leading to illness. Warnings may be less likely to reach women. In countries such as Bangladesh, for example, women who are confined to their homes have no access to radio, TV, or social circles, and this means they can't receive vital information. Although women are more vulnerable than men to disaster, men can also be affected through gender. Men are viewed as more capable physically, and then they are placed with more responsibility that can be left feeling emasculated if they don't do their part or more than their part. In 1998, during a hurricane in El Salvador and Guatemala, men were compelled to take very high risks to protect their property, family, and community in order to prove their masculinity. As a result, the highest casualty rate in these countries were that of men and boys. Men working on the front lines of recovery may face greater health risks like infertility from chemical exposure or waterborne disease and floods. Men may not be taught basic skills about cooking, household chores, or caring for others, and may succumb to starving themselves and others. Men may feel inadequate in asking for help, leading to inability to obtain provisions or recovery aid. And of course, gender does not only include male and female. Transgendered individuals are also vulnerable during a disaster. Stigma of being transgendered can affect how individuals are treated during a disaster. Often transgender deaths go unreported or underreported because they don't fit into traditional categories. Stigma restricts their access to normal channels of information regarding warnings, and they may be ignored during relief and recovery because it's easier to look past them rather than to accommodate them. Physical vulnerability affects the transgendered because they can be attacked, raped, and abused during disaster when rioting and looting make an easy cover. Privacy, such as facilities for refuge and toileting, leave them vulnerable to physical and verbal attacks. There are a few ways in which these vulnerabilities can be addressed. Women and men and transgendered individuals should be included in all steps of emergency management and at every level to ensure their needs are being addressed properly. Gender-sensitive politics need to be a priority in emergency planning, and recovery efforts may only be male-oriented, so sanitary napkins, contraceptives, and counseling for domestic abuse should be made available even in male-dominated societies. Vulnerabilities should be addressed with each gender group so they can best learn how they can help prevent issues during disaster themselves. Women should be equally compensated with men during relief and recovery efforts, and basic health services provided as part of relief efforts should cater to women's and men's differing needs and be provided in a gender-sensitive manner.